Hello, my name is Harrison Koss. I'm presenting a case today. We're submitting a case entitled Hemoptysis to Hypoxemia, a case of palsy-immune diffuse alveolar hemorrhage in a middle-aged man. So essentially, the patient we had is a 58-year-old male with a history of bacterial endocarditis. He did have his aortic and mitral valves both replaced, who presented to the emergency department due to complaints of shortness of breath and hemoptysis for about 2 days. The hemoptysis was worsening, causing him to have concern and, of course, present to the emergency department. When he arrived, he was visibly uncomfortable in his respiratory status. He was febrile, tachypnic, and his oxygen saturation was 81% on room air when he initially came in. He was initially placed on non-invasive ventilation to try to improve his respiratory status, but unfortunately later in that day he did develop worsening respiratory distress that did necessitate emergent endotracheal intubation and mechanical ventilation. That same day, a CT scan was obtained and is shown in that first image on the left. That was his initial CT scan showing, as you can see, diffuse ground glass opacities bilaterally, and a bronchoscopy was performed that did show progressively bloody aliquots during BAL, which was consistent with a diagnosis of diffuse alveolar hemorrhage. So we did get initial workup, including naturally autoimmune workup, including some also some other tests, of course, sputum cultures, blood cultures, etc. And our workup was negative. Of course, rheumatology was involved in the case, and all of the autoimmune workup did come back negative. However, before all those tests had come back, the patient was started on stress dose steroids, just for the suspicion of an autoimmune component, and with hopes to improve his respiratory status. He did actually get progressively improve with the high dose steroids, and he was able to come off ventilator within a few days of starting corticosteroid therapy. So the patient was eventually extubated, and with improvements in vital signs, with resolution of hemoptysis after several days in the hospital, and it was eventually discharged, was planned for outpatient follow-up with both rheumatology and pulmonology. He did follow up with both pulmonology and rheumatology, as mentioned previously. He first saw pulmonology about 2 weeks later, and he reported complete resolution of his symptoms. He said he had no cough, no shortness of breath, no hemoptysis at all since his discharge. And as you can see in the top right, there was a repeat CT scan that was obtained at that outpatient visit, which showed significant improvement in those opacities seen previously. So the patient did get back to his baseline functional status. So, this case, does highlight a case of palsy-immune diffuse alveolar hemorrhage, considering that no identifiable autoimmune or infectious etiology was found during the workup. And it does show, kind of the importance of, steroid therapy in improving patients with this type of disease. And of course, as we can see, the resolution on CT scan and the general improvement in outcomes with patients started on steroid therapy. Thank you very much.